Hello everyone. I'm Dr. Vijayalakshmi Chikkamath, consultant at Dr. Mohan's Diabetes Specialty Center, JP Nagar, Bangalore. So today here I am to discuss a very running topic or a lengthy topic and one of the most interesting topics, that is weight management and diabetes. So, to make, because it's a lengthy topic and little, detailed one to discuss with, to make it easier for everyone to understand, I have divided it into commonly asked questions which I face during my day-to-day clinical practice. So we can answer them, and hopefully they will clear out your doubts, whichever they are regarding the same topic. Now, going per se into the questions first, let me just brief you very superficially with the knowledge regarding weight, obesity, what exactly is it, how is it managed, how do we classify it, and all. Okay, so weight basically in any patient is measured or taken into account by a parameter called as BMI, that is the body mass index. What exactly is it? It's a ratio of weight in kgs and divided by the height in meters square. This is expressed as kg per meter square, and this is one parameter that we use easily to classify a patient as normal or obese. The ranges go like this. The BMI for a normal person is 18.5 to 22.99. Okay, so any person whose ratio of the BMI is between 18.5 to 22.99 kg per meter square is classified as a normal BMI person. Okay, and now the most recent guidelines have changed these cutoffs for obesity to 23 kg per meter square. Initially it was more than 25. Now it has even more cut down, been even more cut down for Asian Indian population because of the ethnicity and race. And any person with a BMI of 23 kg per meter square or more is classified as obese, or is told that they have obesity. Next point is obesity. What exactly is obesity? How is it harmful? What does it mean? So, obesity in simple language means excessive fat accumulation in the body. Now, how will this affect a person? Excessive fat accumulation. If there is accumulation, let it go on. How should it affect a person? Yes, it will definitely affect a person because obesity doesn't occur just within 1 or 2 days or 1 or 2 months. It is a whole chronic process of years together of chronic or excessive calorie intake, inadequate calorie burning. Now, what happens to these excess calories which are there in the body? They get deposited on, they are converted to fat, getting deposited on the vital organs in the body, and this may affect the vital organ function. And that's how obesity is becoming, the running trend and one of the what do you say, most concerning factors, especially for India. Nowadays obesity doesn't concern, initially it was only concerned or restricted to urban areas, but now even rural areas are extensively getting involved with obesity. And why do we say obesity is so rampant is this recent change in the habits, lifestyle habits. One is sedentary lifestyle is increasing a lot because we are most of the time sitting and working. That is one of the most important factors. And second thing is we are moving from the traditionally healthy fiber rich foods to these recent emergence of energy dense foods which are not very healthy for the body. So this shift in the lifestyle is one of the most important factors for the recent emergence of obesity as so rampant disorder. Okay, so as I said, in obesity the fat gets deposited on the vital organs leading to their dysfunction. So this is the core background. Also, obesity can either be generalized or abdominal obesity. Generalized obesity means fat deposition all over the body, but abdominal obesity means fat deposition in and around the abdominal organs, which is even more dangerous. And how do we say if there is abdominal obesity or not? Is by a parameter called as waist circumference. When you measure the waist circumference of a person, the cutoffs lie like this. if the waist circumference is more than or equal to 90 centimeters in males and more than or equal to 80 centimeters in females, then they are considered to having abdominal obesity, which is one of the most important risk factors for development of these recent non-communicable diseases like type 2 diabetes, dyslipidemia, hypertension, metabolic syndrome, all of these. This is the underlying, one of the most important underlying factors. Okay, so now to proceed further, I will be going ahead with the listed questions. I will just show them off to you. They are here. Okay, so as simple as this. I'll be reading out one by one, and go on discussing them with you. So one of the most important questions, or starting with, the first question is how is being overweight affects diabetes control? Yes, definitely it will affect diabetes control. Like the way I said, overweight, rather I would say deposition of fat around the vital organs. Now, when there is fat deposition on the liver, what happens is there is insulin resistance which is increasing in the liver. The liver is not being able to make use of the insulin which is produced by the pancreas. So that leads to an increased glucose output from the liver. What this will do is go and increase the fat deposition on the pancreas. When there is increased fat deposition on the pancreas, what happens is directly the insulin secretion from the beta cells is hampered. Thus, there is decreased insulin secretion also over a period of time. And this is how being overweight or obese can affect your diabetes control. So, yes, definitely your patient's weight, rather than the patient's weight, I would say the BMI or abdominal obesity, which is most important factor, is going to be taken as one of the factors for diabetes control. Second question is, can weight loss reverse diabetes? Yes, of course. So what is reversal of diabetes? You all know HbA1c below 6.5 without medications for a minimum period of 3 to 6 months. That's how we say that the patient has reversed diabetes. And how do you do that? Is by weight loss, obviously. And the same mechanism that I said earlier, that excessive the weight loss will lead to excessive insulin secretion. So when you're consuming less and burning more, this holding of the calories is coming down, and slowly the fat deposition on the vital organs is coming down. And this is how it helps you reverse diabetes. And it is said that at least 5 to 10% of weight loss from the baseline is required for a person to reverse their type 2 diabetes. Reverse their type 2 diabetes. Let me be very specific. Okay. The third question is, doctor, what is the ideal weight, for a person with diabetes? I wouldn't say there is some ideal weight. I would suggest concentrate more on BMI and waist circumference, as I discussed earlier. So a BMI of 18.5 to 22.99 kg per meter square is a safe BMI or normal BMI. And if you're a male person, then aim or work out to keep your waist circumference below 90 centimeters. And if you're a female, then uh, you know, aim or work out to keep your waist circumference below 80 centimeters. That is what is going to keep you healthy. Okay, fine. The next question is, what kind of diet is best for weight loss in people with diabetes? Okay, so diet is also a very big topic, but let me make it as simple as possible. A few points should be considered while planning a diet for a person who's planning for weight loss. One is the total calorie intake should come down. Second is the carbohydrate content should come down. And there should be an increase in the fiber also, which will help you in various aspects like decreasing the cholesterol, increasing the bulk of the food, which is healthy for you. So these three things should be kept in mind. One is decrease in the calories, decrease in the carbohydrates, and increasing the fiber. This kind of diet, these are the general guidelines that I'm giving. When a diet is planned in this way, it is not only helpful helpful for people to lose weight, but it will also be helpful for people who are already diabetic to even bring their sugars under control. So it's a kind of diet which will help you for both the purposes. Okay, so next question is, are low carbohydrate diets safe and effective for diabetics trying to lose weight? Yes, of course. As I said earlier, the total calories, carbohydrates, both should come down, and the fiber should increase. So this should be the core gist in managing the diet. And mind you, this should be combined with the adequate amount of physical activity to actually have an effect on your weight or your metabolic parameters. Okay, so yes, physical activity part I will come back to. Okay, and is it harder for people with diabetes to lose weight? If so, why? See, I wouldn't say it is harder for people to with diabetes to lose weight. Maybe due to some medications, it may be a little difficult for diabetic patients to lose weight. But it is in general the same process for any person, whether it is a diabetic person or a non-diabetic person. Follow certain lifestyle modifications consistently, and it should be able to show an effect on you. Consistency is the key in this, is what I would say. Okay. Next is, I think, should I completely avoid sugar? No, I think there is a list change in the list. Okay. What kind of diet is best for weight loss and diabetes? I've already discussed that with respect to diabetes. Low calorie, low carb, high fiber. Concentrate on these combined with an adequate amount of physical activity. Okay. And should I completely avoid sugar and sweets while trying to lose weight? This is one of the questions that I frequently receive. So if you want me to answer this question in a yes or no, then definitely I would say yes. Yes would be the answer. But it is better you avoid sweets and sugars to be able to lose adequate amount of weight. But again, there are some conditions applied here. Okay. So we are also looking for consistency in maintaining the diet. Also, what we face in day-to-day practice is that many patients, when they are advised for a very strict diet, they go ahead with the diet, but not for a longer period of time. They come back and tell me, doctor, this is seeming to be like, a torture or not a kind of lifestyle which I think I can maintain in the long run. No, definitely no. So I don't mind a little bit of uncontrolled sugars or increasing my medications a little bit, but I want to follow a lifestyle which is, doesn't feel like a torture to me. So this is one important point which is reflected in this question. If you are a person for whom quitting sweets or sugar is not a big deal, or you are not the one who craves a lot for sweet and sugar, then please go ahead. A big thumbs up. That is going to be a bonus point in you for the weight loss. But if usually how people are, that they would need sweets and sugar once in a while. So once in a while in moderation, like for a cheat meal, is okay, but make sure that you compensate these extra calories by burning more calories also. For example, supposing there's a cheat day that you follow and you go ahead with a binge eat or some kind of energy dense food in the afternoon. What usually we do is we also have an evening snack, we also have a sumptuous dinner. So here you're not cutting down the calories for the rest of the day. And also, since it's a cheat day or a cheat meal, you don't even feel the need to work out because usually it's a relaxing day. So I would not suggest do that. If you're having a energy dense food like sugar or sweets, then it's your responsibility to cut down those extra calories in the further day ahead, or make sure you burn those extra calories that you have eaten. By this, yes, you will not let it have a very big impact on your metabolic parameters. Okay. Next question is, what types of exercise help most with weight loss in diabetics? Yeah. Coming to the physical activity part now, I have spoken in general about diet. Coming to the physical activity, we usually say a moderate intensity aerobic physical activity for at least 1 hour per day for at least 5 days a week is what is recommended. Now, let me split this up with each word by word and try and explain that to you. So, moderate intensity aerobic. Why do we say aerobic? Is because we want the calories to be burnt more. Now, what do you mean by aerobic, moderate intensity aerobic physical activity is the heart rate during that activity should be at least 50 to 70% of your maximum heart rate. There's a formula by which we calculate the maximum heart rate for a patient. Okay, so if by any kind of physical activity you're able to achieve 50 to 70% of that maximum heart rate, then yes, you are burning enough number of calories. That's an indirect indication. So that's why we say moderate intensity aerobic physical activity. So, okay, it's a complex term. Then what do you mean by moderate intensity aerobic physical activities? I'll give you examples. Best one is brisk walking, cycling, swimming, jogging. These all come under moderate intensity aerobic physical activity. You should be doing that for at least 1 hour per day for at least 5 days per week consistently. And mind you, 5 days per week and the 2 days holiday should not be like you're working out from Monday to Friday and Saturday, Sunday you're taking an off. No, the break should not last for more than 24 hours. Okay, so take a weekday off and then a Sunday off, that's okay. But don't take a weekend off and then only work out on the weekdays. And there is also something else called as vigorous intensity physical activity, wherein your heart rate is even more going on the higher side, but and you're burning even more calories. If you're able to do these kind of vigorous intensity physical activities, then it is recommended to be done 20 to 30 minutes a day for 3 days a week. Okay, mind you, before going ahead with any kind of physical activity regimen, I would suggest a cardiac opinion to make sure that your heart is capable enough to withstand the kind of stress it is going through when it is going to work out. So this is also a disclaimer that you have to keep in mind. You cannot just blindly go ahead with any kind of vigorous intensity physical activity without a background cardiac check. So this should be done under the supervision of a medical practitioner and with proper guidance. All right. Okay. And how much physical activity should a diabetic do in a week to lose weight? That's what I had told you in the earlier question itself. That if it's a moderate intensity physical activity, then 1 hour per day at least for at least 5 days a week, and the off that you take should not be more than 24 hours. And if it's a vigorous intensity physical activity, then 20 to 30 minutes per day for 3 times a week is recommended. Okay. And this is also one of the common questions that I face, that what if I can't do intense workouts? Are there any other options? Yes. Usually elderly patients who come to me, we ask them for a brisk walk of certain duration workouts that you can do. And since we recommend 1 hour, if you're not able to do 1 hour in a continuous stretch, then break it down into sessions. Maybe 3 sessions per day, or 15 minutes, 15 minutes, 15 minutes, and then in between, keep yourself active. This is also going to give you equal benefits rather than sitting sedentary. So cut down your sedentary time, also cut down on the calorie intake and modify your physical activity according to your physical needs. I think it's good enough. You can go ahead. It's not a rule that you have to do intense workouts. If you cannot do it due to physical restraints, then we have alternative ways to make sure that the calorie deficit is maintained, right? But these kind of ways depends on patient to patient. What is the physical restraint, if there is any, or what is the other kind of restraint, and then we can plan it accordingly. All right. Okay. Yeah. Can diabetes medications cause weight gain? There are questions that I face day in day out with respect to diabetes medications. So yes, there are medications used in diabetes, treatment of diabetes, which can cause weight gain also, and there are certain types which can cause weight loss also. First, let me deal with the ones which cause weight gain. There are certain varieties of drugs called sulfonylureas, which when used in the long run, do have a tendency of causing a weight gain in the patient. And second, commonly used insulin in the long run does have a tendency of causing weight gain in the patients. But as long as it's not making you go overweight or it's not affecting your blood sugar levels, I wouldn't mind that. But if you're concerned with weight loss is also one of your goals, then make sure you discuss it with your doctor that it's a medications which may lead to a weight gain in the long run. And next question coming to, which are the drugs which can cause weight loss? This is running the round since a long time. Okay, there are many drugs used in the diabetic treatment which can also cause weight loss as one of its co-effects. So one is metformin, the age-old drug which has survived the test of time since decades, can actually, when used in the proper dosage, can cause a good amount of weight loss. Second is SGLT2 inhibitors. There are certain groups of drugs. What they do is they basically prevent the glucose reabsorption from the kidney. So what happens? The glucose is not reabsorbed back into your blood. It is flushed out through the urine. So because glucose is an osmotically active molecule, it will also drag water with it, and there is a flush out of both glucose and water, calories and water content, both are going out. So obviously it's going to cause a weight loss in the patient. But be mindful that since in these group of drugs there is an increased content of glucose in the urine, so one of the coexisting side effects can be an increased risk of genital infections, urine infections in patients taking these drugs. So always consult your doctor and then take them only under registered medical supervisor opinion only. All right. And the next group, this is doing the rounds all over the world, the GLP-1 receptor analogs. That is, what do these group of drugs basically do is they will reduce the one of the effects is they will reduce the calorie intake in the patient. They will basically increase the satisfaction or satiety post food intake. So if a patient was taking certain amount of food and then feeling satisfied, post taking these drugs, even half the amount of food taken will also give him the same satiety. So it is reducing the calorie intake by, one is increasing the satiety, second is decreasing the gastric emptying, that is the gut movement will also be reduced a little bit. So by this, it will in general cause weight loss by reducing the calorie intake, one of the ways. So the examples are the world famous Ozempic, the recently launched Monjaro, which is an injectable once a week one, and there are other molecules in the same group called as liraglutide, etc. But again, be sure or be very vigilant to take it only under the guidance of a registered medical practitioner and not self-medicate. Never ever. Okay, and how do I prevent weight regain after losing it? Yes, this is an equally important component of these lifestyle modifications. It's not only the diet and exercise that I've mentioned earlier. The equally important component is sustainability of these lifestyle modifications, which is going to keep you going. That's what I said earlier, that some patients do come and tell me that, doctor, I cannot do this anymore, or it's really feeling like a torture. That should not be the way your lifestyle modifications should be planned. If so, you have to think and let us know that no, maybe I won't be able to do this modification, maybe I won't be able to do that modification, or maybe, yeah, this is okay, I think I can follow this for a lifetime. This should be the way you should analyze what you can and what you cannot. So basically, how do you prevent that weight regain is sustainability. You have to be consistent in your lifestyle modifications. It's not a 1 month, 2 month, 3 month affair at all. You should it is going to take a longer period of time to sustain your metabolic parameters, to sustain your weight loss. All of this is not going to happen in a jiffy. It is going to take time, right, when you try it the natural way. So you have to be patient, you have to be consistent, and you have to also have a positive attitude that you can do it when you're doing it. Okay, so consistency is the key to maintaining that loss of weight that you have achieved already. So my suggestion would be, go slow, take your time, but modify your lifestyle in such a way that you can follow it for a lifetime. This is what will keep you going. Okay, so here I come towards the end of the question list. I hope I was able to cover most of the aspects with respect to weight loss, weight management, diet, exercise with respect to diabetes. There are, of course, there are many other components which will be there, which will vary according to patient to patient. So I would suggest you can visit us. We will help you and guide you throughout this. Okay, any questions? You can ask me. Yes, there is a question here, Mr. Praveen R. Hello, Mr. Praveen. You have written here that I have diabetes for 15 years and I am um, 37. Yes, and what is the 15 years and you're 37? So since you are 22 years old, you have diabetes. So first thing is classify the kind of diabetes that you have, and your treatment and lifestyle modifications will depend on what type of diabetic are you. Is it a type 1, type 2, MODI? All of that has to be classified. So yes, the answer is, first we have to know what is the kind of diabetes in you and then proceed forward. Okay, fine. I hope I was able to connect well with you people and help you as much as I could and guide you through the weight loss journey. For any such details, for more such details, please do visit us. Thank you so much. Bye.